Ireland needs a new children's hospital, and the wait for this facility has been far too long.
We're at a great milestone for the project. All the thousands of hours of engagement with the users, the staff, the parents, the families, the residents have all been taken on board. We've distilled that down into a world-class design. We're lodging to On Board Penola for planning permission.
I think the enormous strength of the St James's campus site is that it allows us to co-locate the Children's Hospital with what is the largest adult teaching hospital in the state.
We have got to be tri-located. The reason being is that gives the best clinical outcomes.
The development of tri-location, that is paediatric, maternity and adult on the same site, offers great possibilities.
St James is a wonderful opportunity. It's our biggest teaching hospital. This is the best model of care. This will be the centre of excellence.
From a service delivery perspective, it just affords us a fantastic opportunity to replicate the best healthcare system for children, and it's as good as anywhere in the world.
The lodging of the planning application is an enormous milestone, particularly in my current role as Minister for Health. It's something that I'm really delighted to be associated with. The planning application is now in. All things going to plan, we'll have planning permission within a few months' time, and we can start construction next year.
It's a comfort to me as a parent of two children with a lifelong condition that they will be attending a hospital where everything is under one roof, and that in the future that they can access that hospital themselves with public transport, and they can take control of the condition as adolescents and young adults.
The hospital is about providing the best care for children regionally, locally, nationally.
We're going to have 2 satellite units, and one will be based here on the grounds of Tallaght. So there will be clinics running there every day, and there will also be an urgent care, so a facility where children with acute needs will be treated by my emergency colleague physicians. That same model has been replicated on the grounds of Connolly Blanchetown, serving North Dublin and its hinterland.
There's going to be all services under one roof, and I think that means so much to parents that the child won't have to be transferred to another hospital.
I think it will make our job as nurses a lot easier, but I think it will impact mostly for the families and the patients who attend our hospital here.
When my mum stays with me, I wish she could have her own bed because she's sleeping on the rug at the moment.
Make the room a bit more open, bigger, because some of the rooms are small and it's kind of hard to get by.
Typically a journey for us would be about 4.5 hours. You don't need the stress of where am I going to park the car. It'd be great just to have everything else taken off you and just let you concentrate on your child.
We look forward to working in this hospital. We look forward to looking after children literally from the womb until they graduate from our service.
But having all that expertise together under one roof will further improve the quality of care and put us on par with other international centres.
The new Children's Hospital is a once-in-a-lifetime opportunity for the community here. The best and the finest hospitals in the world are totally engaged and committed with their communities. We want to deliver on that.
The hospital can be a real catalyst for change in the area and regeneration in the area. There's no doubt about that.
The new Children's Hospital will simplify life for both the parents and the children because it'll have single-room accommodation, access in and out of the hospital by the Lewis. It'll be bright, fantastic new hospital.
I would say there isn't a week goes by when we don't think it'll be so much better when we're all working from one hospital site.
The facilities that will be offered will be world class.
It's going to mean access to great facilities and even better services for kids and their families.
And it will not only be an excellent facility for the patients of today, but also for generations of children to come.
The most important thing for any parent of a seriously sick child is the clinical outcomes. Anything else pales into insignificance. This site will give the best clinical outcome for the children of Ireland. The most important thing now is the speed at which we can get it built.